AMP2.TV presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hi, welcome to You and Your Doctors. I'm Marina Anderson, your life and energy coach, and I'd like to welcome all of you to our show this evening. This is being an AMP2 Productions and proudly sponsored by All County Healthcare, where patients are the heart of their business. So I'd like to welcome you tonight. I'd love for you to participate. We have a telephone number for you to call in to ask our guests any kind of questions that might come up. The telephone number is 888-565-1470. We're also filming live on wwnnradio.com and allcountyhealthcare.com as well. The other thing that I'd like to do is welcome all of our Facebook guests that are here through All County Healthcare. We are very, very excited to have you here with us. And if there's any questions that you might have for All County Healthcare, please call them at 888-717-7170. Ask for Maddie. She would love to be able to answer 80 questions that you might have concerning your health care and after hospital care as well. So, without any further ado, you and your doctors, All County Healthcare has brought together all the professionals, whether it's a doctor, somebody in the insurance company, somebody's running clinics. They have brought together these professionals to be able to help educate and inform you, especially when it comes to your health care. The other thing that's really important is that when you come to the age 65 and you have the Medicare choices, it's really, really important that you make the right choice, because usually what happens is in that choice that you make, you must live with it. So that's why we're on air tonight, to help you be able to make those choices that are going to serve you the best. So without any further ado, I am so excited to introduce my guests for this evening, the first half of this evening, and we'll have another guest for the second half. I'm very excited about that, too. I would like to introduce our guest tonight, Dr. Marina Rabkin, and she comes to us from Medical Center Affiliates. And so welcome, doctor. How are you?
Thank you so much for having me here. Thank you. I'm good.
Oh, it is wonderful to have you here. So give us a little bit of an insight. I hear a little bit of an accent there. Tell me about where you have, I was going to say originated from, what country you've come from.
Yeah, I came from former Soviet Union. 26 years ago to United States and became a doctor here. I was a doctor in my country too.
Oh my goodness.
So I just continue to be a doctor here in the United States.
Excellent. So what part of the Soviet Union the former Soviet Union?
Former Soviet Union, Uzbekistan. It's an Asia part of the Soviet Union.
Very interesting. So what made you decide that you wanted to become a doctor? What inspired you?
Well, I guess I didn't have a choice because all my family were doctors. My mom and my dad, and
really? It runs in the family.
It runs in the family, so I didn't have any choice.
You're going to be a doctor, huh?
You're going to be a doctor. Don't have any choice. So, which I, no regrets of that, and I'm very happy to be a doctor here.
That is wonderful. Now, have you followed in your family's footsteps in terms of your specialty?
Well, my mom was OBGYN in my country.
Oh, okay.
My father was internal medicine, so I'm doing family practice. It's very close.
Oh, okay.
To what he did.
I see. Well, that's really interesting. So how long have you been here in the States?
26 years.
Oh, my goodness. Okay. All right. Excellent. Yeah. And where did you, when you came to the States, where did you land, shall I ask?
Well, I landed in New York.
Okay.
And I finished residency, passed my exam, of course, and I finished residency in upstate New York in Yonkers.
Oh, okay, beautiful.
Yeah, and I was working in Brooklyn for several years before I came to Florida.
All right. How long have you been down here?
In Florida altogether about 9 years, but in here in Boca about 2 years.
Oh, okay, great. Well, tell us a little bit about your practice and your patients, your primary care. What is it that you help them with?
So I'm here to represent MCA. It's Medical Center Affiliates. We have 10 offices located from West Palm Beach down to Fort Lauderdale. So my office located at West Palmetto Road and Power Line.
Okay.
So here in Boca.
Okay, great.
So we taking care of elderly people most of the time, and we kind of concentrated on preventative care. So we're doing a lot of things. We do simple procedures in the office. I'm doing skin procedures, very, simple skin procedures in my office. We do EKG, we do physical exam, we do blood work, we do spirometry in the office. We do injections in the office. So we do a lot of things to prevent patients to going to the hospital.
Oh, excellent. Well, that sounds really important because a lot of times, if you can take care of something in the office, that's going to be a lot less money. Not only that, but it sounds like you've got a good resource there. So
we do. And in addition to that, we try to be open, we open on Saturdays just for our patients to come if they need some help instead of going to emergency room.
Oh, wonderful.
So we're open on Saturdays.
That is really, really an excellent idea because a lot of times, things happen over the weekend. And a lot of times the only alternative is the emergency room.
Yes.
And that's very costly.
Yeah.
Wow.
So they love this
excellent.
idea to come to us because we know them and we can help.
I got you. Well, that's wonderful. So you've been in down here with MCA, it's called Medical Center Affiliates, okay, otherwise known as MCA. You've been down here with them for 2 years?
Yes.
Beautiful.
2 years.
Tell us a little bit more about your background as well. I know now you came from the former Soviet Union.
Yes, I finished my medical school there.
Okay.
So I was working as a doctor in my country before I came to United States. So you have to pass exams and then, finish residency and work.
Okay. Okay.
So that's why I have my accent.
I love your accent.
So I
That's
speak
very
fluent
nice.
in Russian and
Do you?
English.
Now, do you find that there's patients that need that language, Russian language?
Oh, yeah, they do.
Really?
They do. Even some patients, they speak perfect English. They feel more comfortable to speak their own language. They can express themselves better in their own language.
I mean, that's quite a gift. And you're absolutely right. One of the things that I'm finding is that just in talking with you, that you have a beautiful bedside manner. I mean, you've got a wonderful, warm personality, and
Thank you.
and that's one of the things that I've noticed with the doctors at MCA, that they really do care about their patients.
We do, and I just want to add, we have different doctors with different backgrounds.
Please
we
share.
speak different languages.
Wow.
We also have on the side specialists. We have endocrinologists, we have rheumatology, we have neurologists on the side. So we try to kind of help our patients from different angles.
Okay. How many doctors are in your office?
In my particular office, just me.
Oh, okay. All right.
It's just me. So we have 10 offices, we have 10 doctors, and plus we have specialists, like I mentioned, endocrinology, rheumatology, neurologist, and...
Say that backwards 5 times, huh?
Yeah.
Oh, that's great. So, does each doctor have their own office, or do they float?
Yeah, they have their own office,
Okay.
each of them. Yeah.
Excellent. Excellent. So you handle the family practice piece of it.
Family practice, and also I want to mention I go to nursing homes and ALFs.
Oh, do you really?
Yeah, I do kind of house calls there.
Oh my gosh, a doctor who does house calls.
Yeah.
That is incredible.
So I see patient there in Brookdale Boca location.
Okay. Okay. So what is the normal age of your patients?
Well, it varies. You know, we have different, because we take different kind of insurance plus commercial insurance. So we have from maybe 30s and until I have the oldest patient, I have 101.
Oh my goodness. 101.
Yeah.
Wow.
So that's the range we have.
That's fabulous. Kudos to you. Helping that individual, stay strong and lively and still alive.
Still alive.
Oh, that seems to be a new up and coming generation, is the Centurion.
Yes, it is. It's very interesting, and they're very interesting patients. Besides, they have, of course, some problems, but they have a lot of interesting things in their life they share.
I would imagine after 100
Yeah.
years of being on this planet, I can't even imagine the changes that they've experienced and what they've gone through.
Yeah, very lovely people.
Oh, yeah. Yes, I know one or two of them, but just amazing stories that they have. And they can remember them. I have a hard time remembering what I ate yesterday for dinner.
They do remember, yeah.
Yeah. Well, I would just like to say thank you, All County Healthcare, for sponsoring this evening, for bringing in our guest, bringing in the professionals to help educate and inform us so that we have the ability of making those decisions, those choices that are so vital to our healthcare. So I want to thank you very much. So tell us a little bit more about, do you have insurance, any kinds of insurance that you offer, that you take?
We take all major insurances. We take Medicare. We have supplements.
Okay.
We have commercial insurances. We take, basically all major insurances, and we welcome new patients.
Do you?
Yes, we welcome new patients, and we're taking walk-ins too. So
Wow.
we do usually schedule the appointments for the new patients, but if some kind of problem, we usually take the walk-ins too.
What do you usually see for individuals that come in? I mean, is there? You were talking about that you were doing minor skin surgery.
The biopsies.
Biopsy.
Yeah.
Okay.
Because we're in Florida, we have all kind of issue with the skin, and sometimes instead of sending elderly person who cannot drive to the dermatology, I can do small procedures there.
Gotcha. What else do you do for prevention? Because you were beginning to talk about it, but I'd like to get a better viewpoint or a more in-depth idea about it.
So, like I mentioned, we do physical exams. We do the EKG. We do spirometry. I do women exam. I do the pap smears in the office.
Oh, okay.
So all this.
So they don't really necessarily have to go to a specialist.
Yeah.
Wow. Okay,
Yeah.
that's very interesting.
But if they do need a specialist, if some elderly people they cannot drive, we provide transportation.
You do?
Yeah, we have for free. It's
Wow.
transportation
So you not only do
allocation.
house calls, but you also provide transportation?
Transportation. We provide transportation to our office and to the specialist if they need to see somebody.
That is amazing.
Yeah.
That is unheard of, these
Yeah.
days, is that, somebody would end up going above and beyond the call of duty. So I
We
commend
try
you.
to do best for our patient. We understand where they're coming from. They cannot drive. They feel dizzy, and and we want them to get health care, whatever they need.
Because a lot of times, if they've got their health, then they have quality of life, which enhances their quantity of life. It
Yeah,
all
and
works
it's less
together.
worry for them and for the family, because somebody like family members, children, they have to take day off to get mom or dad to the doctor.
Right. And if they don't live here, then they're really
They don't, yeah.
they're
many
having
of them,
difficulties. Yes,
out of state, so we help.
that is wonderful. And not only that, but you're taking new patients.
We do.
How are you fitting all this in?
We do.
I mean, you're working 6 days a week.
We work 5 days a week.
Plus Saturday, though.
Plus Saturday.
Uh-huh.
Yes, we do. On Saturday, we work on special locations. We not open in our office.
Okay.
But it was from 10 locations, 3 offices they open for urgent care, we call it.
Okay. Okay.
So we do work a lot.
Yes, you do. Yes, you do. But you know something, though, I really do appreciate that because you're creating a convenience for those people that have difficulties, either with transportation or being able to get to the doctor. And and not only that, but what I'm feeling is such a warmth and a kindness and just the ability of really being there for the client. And I want to commend you for that. That is absolutely wonderful. And
we have a very
need
nice office, and we have nice staff in the office. Mm-hmm. We have a manager, we have MA. They're very nice and helpful.
That is great. Yeah. That is absolutely wonderful. So what hospitals are you affiliated with?
We're not affiliated with the hospitals. We don't go to see patients in the hospitals.
Okay.
But what we do, we have utilization team, which, for example, if they know that our patient in the hospital, they inform us, or we inform them if we know first, and they call there. So they try to contact with a hospitalist there who's taking care of them, or specialist, whoever.
Okay.
And we usually call the patient even into the room. Mm-hmm. So we know what's going on with the patient, and as soon as patient discharged from the hospital, we see them in 2 days in our office.
Okay, for follow-up,
For
correct?
the follow-up, yeah.
Gotcha. So tell the audience again where you're located.
So we're located at 7,000 West Palmetto Road. It's between Power Line and West Palmetto Road, Garden Shopping Mall, and Suite 103. And our phone number is 561-347-8122.
Excellent.
Yes, and like I said, we're welcoming new patients.
That's wonderful. And do you have a website?
We have MCA.com, medicalcenteraffiliates.com.
Okay, great. Excellent.
So.
Excellent. Because I just want to make sure that, if you are in need of a family doctor, family practice doctor, please, by all means, give her a call. Say your telephone number just one more time and a little slow so they have a chance of writing it down.
Okay, it's 561-347-8122.
Excellent.
And again, we're located in Garden Shopping Mall between Power Line and Palmetto.
Excellent.
7,000 West Palmetto Road, Suite 103.
That is wonderful. Wonderful. So, and this is your time now. If you have any questions for our guest, please give us a call at 888-565-1470. We're ready and willing to take on any question that you might have for the doctor, anything that might be coming up, or concerns as well. The other thing also that I want to point out is that we're streaming live. We're on Facebook Live, so I'm welcoming all those visitors this evening on All County Healthcare. And you can call 888-717-7170, ask for Maddie, and she will answer any of your healthcare needs for All County Healthcare. So please give her a call if you need any after hospital care or any in-home care as well. Well, I've got to tell you, Doctor, it has been absolutely wonderful having you here.
Thank you so much.
What else would you like to share with the audience?
I did mention, by the way, we do have, I forgot to tell that, massage therapist.
Oh, you did?
Yeah, and we have it for free.
Oh,
and
my
we
goodness.
have nail tech in our office, so you can get your nails done while you're waiting
This
for
is
the
like a
doctor.
spa. Do you have spa music as well?
We have a music, yes, we do.
Oh, that is absolutely wonderful. Can I come?
Yes. Make an appointment.
Yes, yeah, absolutely, absolutely.
Yes,
Will they come pick me
yes.
up? That's fabulous. That's very, very unique for a doctor's office to have a massage
The
therapist.
massage therapist, we schedule the appointment like once a week. They come in our office and do it for free.
Oh,
So,
right.
yeah.
Oh, that's fabulous.
Yeah,
That
and
is.
our patients, they love it.
Oh, I can imagine. I can
Yeah, they
imagine.
love it.
And a nail tech as well, like
And nail tech, yeah.
for pedicures and manicures.
Pedicures. Manicures.
Manicures.
No, sorry, yeah.
Okay. All right.
I didn't see
That's
her
very-
doing pedicure.
That's very interesting.
So.
Beautiful. What else is different? Tell us something that's really, really different. What makes you stand apart? Other than you provide transportation, you're open on Saturdays at 3 of the locations. You offer massage therapy.
Right.
You offer pedicures, manicures, excuse
Manicures.
me. Can you get your hair done there? No, I'm only kidding.
Not yet.
Not yet. What else do you end up? What else makes you different? What makes you stand out?
Well, we love our patients, and I think that's the main thing.
Oh,
And
yeah.
if you would like, you can ask our patients, existing patients, they love to come to our office because it's so warm there.
Oh,
Like I mentioned, our staff is great and very helpful. Mm-hmm. And it's like no waiting time. You just, everything is on time.
really?
Everything is on time, and you don't wait for your appointment. If your appointment's scheduled at 9, you're going to be seen at 9.
I
So-
like that too. Yeah. Okay, that is different.
And plus, we're not rushing patients out of our office. We spend time. So I have maybe 30 minutes for the patient.
Really?
So this is very important.
That is very important.
Yeah.
Yes.
So it's not like every 5 minutes I have a patient.
Wow, that is really.
So they can talk to me, I can talk to them, and we can discuss whatever health issue they have, whatever questions they have. Sometimes they have to tell you about their family problems, that happens too. And, they're lonely, most of them.
Yeah.
They live here, and, it's retirement state, so the children may be away, and they love to talk. So we try to give them time. Not to show them, okay, your time is up.
Yeah,
I
here,
have to
let me
see,
check the clock.
let
Okay,
me
now
see,
it's time.
next patient, So that's what we're trying to do.
That is
So
wonderful.
we take our time with patients.
And that's so important. It's not only important for their physical health, but it's important for their mental health and their emotional health, because a lot
Yeah.
of times they just want to be heard. They want to
Right.
make sure that these are feelings that they're going through. These are their daily life, and to be able to have somebody that they can talk to, and especially in the medical field, because that's what they're dealing with a lot of times,
They
the
do.
medical issues. I mean, I know that there's many times in like the nursing care, nursing homes, or even the daycare centers for adults. The whole conversation is about the amount of doctors that they're going to see, and the medications that they're on, and what their ailments are, and it's tough for them because they don't have an outlet. They don't have somebody that they can talk
They
to
can talk,
and that they can relate with.
So sometimes you have to work as a psychologist too.
Yes, I would understand that. I would understand that because I was a therapist as well. So,
Yeah.
you have to allow them to be able to connect.
To connect, and they appreciate that. They appreciate a lot this. So
Yeah.
that's what I think make us different. And it's not just our office. So all our 10 offices, we're trying to do the best.
That is
the
wonderful.
patients.
Now, I don't expect you to know all the addresses for the 10
No,
locations.
don't ask that. I don't know.
Okay, but one of the things that you can do is that you can call Dr. Rabkin at this telephone number, 561-347-8122, and she can put you in touch with the various specialty doctors and also the locations, because they can help get you to the right location in your area.
Yeah,
And-
and I'm sorry, you can go to our website, and we have all locations on the website.
Okay, and that is www.medcenterinc.com. Is that
No, this is the email you have. This is the email.
Let me see here.
The MCA should be MCA.com.
MC.com?
Yeah, Medical Center Affiliates.
Okay, MCA.com, right?
MCA.
Okay, all right.
Yeah.
So you can do either one. You can either give her a call or you can go on the website as well. Well, that is wonderful. I can't thank you enough for being part of this evening, for helping to inform and educate our audience, and to let them know that there are doctors out there that really do care, that really want the best for the patients, and also create the conveniences that are so important for that population. So I thank you so very much for coming.
You're welcome, and thank you for having me here.
It is
was a
my pleasure. It is my pleasure. Well, we're going to break for commercial at the moment, and don't leave. Come on back. We have another doctor for you as well, Dr. Frank Snipes. So we will be right back.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
Getting older is not for sissies. That's what one of my patients says. And it's funny, but it's true. Live long enough and you'll get arthritis, skin cancer, probably one of the common chronic diseases like CHF, COPD, diabetes. At All County Healthcare, we teach you how to manage your disease. We make sure you know how to take your medications and how to recognize signs and symptoms before requiring hospitalization, no matter how many visits it takes. You didn't move to Florida to be sick. You moved here to enjoy the rest of your life. And that's exactly what our team of nurses, therapists, and aides at All County Healthcare help you do.
You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Hi, welcome back to You and Your Doctors. This is an AMP2 TV Productions, and it's proudly sponsored by All County Healthcare, where patients are the heart of their business. So, welcome back. I'm glad you stayed with us. I'd like to let you know that we are streaming live on allcountyhealthcare.com. We're also streaming live on wwnnradio.com, You and Your Doctor. And welcome to our Facebook followers. It is wonderful to have you here with us on All County Healthcare on Facebook. So it is a pleasure. If you have any questions whatsoever for All County Healthcare, please call them at 888-717-7170. Ask for Maddie. She would love to answer any questions that you might have about aftercare from the hospital, or if you need help, registered nurses, just home health care. Ask anything that you might need for your home and for your loved ones or for yourself. Well, it is with great pleasure that I introduce our next guest. His name is Dr. Frank Snipes, and he comes to us also as a gift from All County Healthcare.
Okay.
They invited him, and so it's wonderful to
Thank
have you.
Appreciate it. Thank you.
Well, tell us a little bit about you.
Well, I'm 58 years old. I'm an internal medicine physician. Starting from scratch, I was born in the St. Louis area in Missouri.
Oh, okay.
Grew up on a farm, and that's where I decided I want to be a physician. So basically,
What was it? What was it that made you decide that?
you know, I thought, to be honest with you, I'd be a veterinarian for a while, and then I thought, no, I think I'd rather be with humans as opposed to animals.
Because they can tell you what's
although
wrong.
sometimes it's the same. But basically, that being said, there was a 6-year program out of high school. It was in Kansas City.
Okay.
And so literally, I just got in a car and drove up there and interviewed, looked at it, and got in. And then basically, that was 6 years later, you had your MD. So then I went to a family practice program in Pensacola, Florida.
Okay.
That's where I fell in love with Florida.
Oh, I was going to say, is that what brought you down to
Absolutely.
Florida?
That's what brought it down.
Okay.
And then from there, I thought, I really want to take care of sicker adults, internal medicine. So then I
Okay.
went to St. Louis and did another internal medicine residency on top of that. And then from there, kind of hit the fan, went everywhere. Was in Phoenix, Arizona for a number of years. Did hospital medicine, inpatient. I did outpatient private practice, did a little bit of both. And then went through a divorce and then came to Florida. And that was in 2010, 2011.
Okay.
So basically, what I'm doing now is kind of a gamish of several things. I'm doing internal medicine in Fort Lauderdale. Basically, I'm working in a drug rehab, doing internal medicine there.
Okay.
On Wednesday.
Where are you in Fort Lauderdale?
That's the Presti Medical.
Okay.
And that's the one that's in Fort Lauderdale.
Okay, and I'll just read the.
Okay, because they gave you all
I'll
the
read
addresses.
the address
Yeah,
here.
that's
Yes,
right, yeah.
yes, and that's located at 3075 East Commercial Boulevard. That's in Suite 1A in Fort Lauderdale, Florida. The phone number there is 954-491-6200. If you have any questions for the doctor, you want to give him a call, you want to set an appointment, please, by all means. And also, if you happen to have any questions for the doctor this evening, please call us here at 888-565-1470. Give us a call. We'd love to talk to you.
Sounds good to me.
Yes. So you ended up in Fort Lauderdale, and you said that you had, there's some other offices that you have as well. You have 3 offices altogether?
Well, really, right at the moment, I'm working eventually 2 days a week in Presti Medical. I used to work there all the time for 3 years. But then I also got interested in this drug rehab called Ebtide. It's an inpatient, it's a partial hospitalization and an intensive outpatient program in the North Palm Beach area. So I work there.
Okay, I'm going to give the address as well.
Absolutely.
So that's kind of like a treatment center
It
for...
is a drug and alcohol treatment center.
Okay.
So I work there. And then basically in Miami Gardens, I work at the Center for Family and Child Enrichment doing internal medicine.
I have got to tell you, you
Well,
have reached the gamut. You've gone from one to the other.
Well, I live in a
My
phone
goodness.
booth, I guess, yeah. But
I was in sales. I lived in my car. I understand.
I understand that. And it is driving around quite a bit.
Well, I'm going to give the Ebtide Treatment Center, and that's located at 3385
Huh?
Burns Road, Suite 108, and that's in North Palm Beach, Florida, 33410. The telephone number there is 561-508-8330. So if you or a loved one are dealing with alcohol or drug issues, please give Dr. Frank Snipes a phone call there. He can help get your loved one or yourself help. Please give him a call. And then the other one that's located, this is for Family and Child Enrichment, Center for Family and Child Enrichment.
I know, that's a hard, I know, it's a long term. I know, it's
And that's located at 1825 Northwest 167th Street in Miami Gardens, Florida, 33056. The telephone number there is 305-474-1800. So, you've gone from Miami Gardens, Fort Lauderdale,
North Palm Beach.
and North Palm Beach.
I know, it's I know. I know. I really,
You must have a lot of mileage on that car.
well, I
of yours,
know.
huh?
I need a thyroid condition or something because it's a lot of running around.
Yes.
But it just sort of fell that way. It really didn't intend to be that way. It just sort of
Well,
happened.
you know something? I really want to commend you, though.
Well, thank you.
because you've really put yourself out there so that you can really be open and available for all ages, for all situations. I mean, I've got my master's in social work. I was in the addictions field, so
Well, there you go.
I totally understand
Yeah.
how important that is. I also understand that, especially, Fort Lauderdale has got its little nickname called, Fort Liquordale.
Yeah. Yeah.
And it, it's a growing problem.
It is. It's huge.
It is huge.
And
So
in fact,
I commend you for really, putting yourself out. I mean,
well, thank you.
do you work Monday through Friday or Monday through Saturday, or
Well,
how do you
Monday
do
through
that?
Friday. Yeah.
Okay.
And but it just kind of happened that way. Really, it wasn't really planned. It just sort of fell that way. But yeah, I mean, it gives different facets of healthcare at the same time.
Yeah, absolutely. And how important it is as well to be able to have that kind of flexibility, and that you would end up, putting in that kind of time. I hope you're living right in the middle of all of
No,
it.
well, sort of, kind of. I'm in Fort Lauderdale, yes.
Oh,
That
okay.
makes it somewhat easier.
Okay, yeah.
But we were talking about home health. Home health
Yes.
is extremely important, and people don't know how much of an extension they can be to an internal medicine physician or whoever, family physician, whatever. Because patients are lost a lot of times.
Okay.
They have a loved one, they don't know what to do with them, they're having some cognitive disorders or whatever, they're getting to a point where they're falling and so on and so forth, and home health can do a tremendous amount in terms of home safety evaluations, looking to see if there's rugs on the floor they can fall on, they can check for personal needs, do they need somebody to help shower, help bathe them, that sort of thing, feed them. So they do a tremendous amount of work.
Yeah, and I also heard lighting. You've got to make sure that the
That
lighting,
the lighting is appropriate and so on.
yes,
Absolutely.
and that there's no cords around either. Because you're right, falling is one of the major issues that the elderly do have within their own home.
They
So
do.
All County Healthcare has really managed to cover the gamut and be able to provide that for them. That's wonderful.
Oh, good.
So tell us more about, let's see, your residency program. Speak to us about that.
Basically, I did 2 of them only because back at that time, that was in the mid-'80s. And in the mid-'80s, family practice was a up-and-coming thing. And it was fine. I enjoyed it, absolutely. It gave me a good broad foundation, but as it got toward the end of it, I thought I really would like to take care of more like intensive care patients, that sort of thing. So I did that in St. Louis, and it was a good place to train in St. Louis. It really was. It was a good intensive place, a lot of great hospitals up there. And then, so it's helped as far as a base with which to provide care. And the thing that I think, if you want to talk to patients out there, listening audience, is just the maze of insurance problems. I'm not trying to turn the topic, but basically, it open enrollment is coming up in November.
Absolutely, I totally agree with you, and it can be so confusing.
It's horribly confusing. So if anybody has a question about that, let us know, because we go through this every single day with different patients and such. Because it's a huge topic.
There's so much to pick from.
There is.
And not only that, but it's not only that they have so much to pick from, but then there's the HMOs that come in as well, and sometimes that doesn't always serve the client.
The need, absolutely,
And the
particularly
need.
with snowbirds. The thing with HMOs, we're kind of getting off on a tangent here, but with HMOs, snowbirds sometimes don't understand that it's a very local, sometimes even a county-wide coverage, and that's all.
Oh, wow.
So Miami-Dade versus Broward and such, much less if they want to go back to New York, for example, to a certain particular hospital, a cancer institute like Sloan Kettering, they can't on an HMO if it's local. So, that's where you get into PPOs and POS plans and so on and so forth. So it gets confusing.
It's
Oh,
confusing,
I know.
and I'm not even there yet.
I know it is. It's horrible, but it basically does help. And so if anybody has any questions on that, let us know. But
Well, what number can they reach you at?
really, I guess the best number is through any one of the 3, really, because I'm kind of bouncing around all week. So any one of the
Okay.
three, really, to be honest.
All right. I'm going to give you these telephone numbers again so that you can get a hold of Dr. Frank Snipes. The first one is 305-474-1800, and that's in Miami Gardens. And then there is in Fort Lauderdale, the 954-491-6200. And the one up in North Palm Beach, that is 561-508-8330. So if you have any questions whatsoever about the insurance, especially if you're coming into the 65-year-old
Oh, absolutely.
range,
No, it's a huge difference.
it is a huge difference.
is.
And not only that, but if you make these choices, at 65 and you really don't know what you're doing and what choice, you have to live with that.
You do. Unless there's a life change, like a divorce or a marriage or the death of a spouse or losing a job, you're pretty much stuck with whatever you've chosen for that year.
Okay.
And it's important for patients to know if they're going to have major procedures, if they want to do a procedure in New York and come back down here and so on and so forth, they're better off to opt out and get straight Medicare with a secondary, which is more expensive.
Is that Medicare Part A?
Part B. Well,
Part
A
B.
is for the
A
hospital.
is for the
That's
hospital.
B is for the
Okay.
physician.
Okay.
But if you're in an HMO, I mean, if you can afford it, you can opt out of that at the end of the year, spend a year in Medicare with a secondary, and then have that chance to, if you, God forbid, get an illness that you need to dance back and forth or go to a cancer institute or a certain place, or you want to go to Miami, for example, for an eye physician specifically or a back surgery, and then after that year, you can opt back into an HMO.
Okay.
So you're not stuck for a lifetime, but you are kind
Okay.
of pretty much stuck
You're
for
stuck
a year.
for a year.
Unless something happens.
Yeah.
But you got to think about that because that's coming up in November 1st.
November
through
1st.
January the 31st of next year.
Okay. So be aware. If you
Yeah.
have any questions, I gave you the telephone numbers. Please call the doctor. And or you can call in right now, 888-565-1470. We would love to answer any of the questions that you might have concerning that. So, and that kind of brings us back also to some of the insurance companies that you're dealing with. I mean, it not only is it confusing for the patient,
Oh, it's confusing for everybody.
and it's very confusing for the doctors as well.
It is.
Tell
And
us about that.
Well, in before the 80s, insurance companies were, and I'm not bad-mouthing insurance companies at all, but basically their attitude was different. They basically were there to cover the cost of whatever physicians and hospitals and whatnot did. Then it changed basically where they were more involved and to the point of making contracts with certain physicians or certain physical therapy departments or home health agencies, labs. So they got more and more control, and it has really just continued and continued and continued. So some of the frustration that physicians have is that they don't have a lot of the freedom to maybe go to a specialist or refer to a specialist they want to, or even a lab. There's more
Restrictions. huh?
and paperwork to boot on a particular plan or physician. So, yeah, you get locked into that sort of thing, and that's where some of the frustration has been from physicians and patients for sure.
Yes, absolutely.
It is.
And I pretty much understand that. I mean, I have one of my clients who is a doctor, and sometimes the frustration that she says that she has to go through.
Oh, it's tremendous.
Yeah, and just being able to get paid as well.
It is. It is.
Yeah.
And unfortunately, primary care has been kind of pounded on financially because that's why, but really, to be honest with you, that's what they're trying to do is increase more primary care physicians.
Are they?
Because that's where the center or the
hub.
cogwheel, the hub, so
The
to
hub,
speak,
yes.
exactly, is kind of involved so that you can keep people out of the hospital, you can keep them healthier, and so on and so forth. At least that's the idea.
Yes. So I just want to say thank you very much to All County Healthcare for sponsoring this show, you and your doctors, and also for bringing on the various doctors, the professionals that are in the industry, in the healthcare industry, to help keep you informed and educated about the choices that are the best for you and how to make those choices. And not only that, I want to commend all the doctors that we have had on the show because they give so freely. Advice, they give out their telephone numbers, they give out their websites. They want to be able to help you so that you can have the quality of life that's so important. So I want to say thank you to All County Healthcare for providing that for us.
I agree.
Yes, it's so essential, and thank goodness that you're there to be able to help those individuals, especially when they start getting in not only 65, but when they start getting in their 68 or 72, or especially if they've had a health condition such as a stroke, like my mom had a stroke, and then all of a sudden it's kind of like. Part of the cognition is gone, the memory's gone. So, it's so important to have somebody there that really can answer those questions and help them through the maze. Because, I've got to tell you, it is a maze.
It is. And, younger patients now, between 65 and down to 30, are getting stressed out. I see a lot of patients that are just have stress-related illnesses.
Really?
GI problems, headaches, whatnot, and there's a lot of stress and depression out there. I mean, a lot of anxiety and depression. So,
and what do you think you attribute that to?
2016. Just everything
Just the
is
year?
getting crazier. The world is getting crazier. Everything's getting tighter and more stressful. Just to live is more stressful. Traffic, credit cards, debit cards. I mean, just everything.
Wow.
And it's just a stressful more, than
and
it was.
the work related. I remember when we ended up, maybe about 25 years ago, the whole society ended up going through the downsizing.
Absolutely.
And there were so many people that ended up losing their jobs and really not quite knowing what to do at that point and how they were going to bring in an income. And many people ended up going through their savings account. But then on the other hand, that's where the entrepreneurs have really come alive.
They did.
Yes.
But it just seems like you see people all the time that are either losing their job or just life stresses, whether it be relationship or business or just anything. And it sure drives people in. If you ask. A lot of times people never ask, and I think that makes a big difference.
I think I have to agree with you because, pride can really stand in your way many times.
Oh, it does. And men, you guys out there, men are bad patients. They never admit. They come in for a hypertension or a bronchitis, and you got to pull it out of them. Wow. And then they start saying, well, yeah, they're... You certainly get a pretty classic picture of depression out of a lot of them. So
yes.
You men start feeling out there.
Yeah, well, that's very interesting that you would say that because I work with a lot of men, and those men, you're right, they have a very difficult time trying to release the emotions that are all pent up on the inside,
or even not identify it.
Yeah. Well, they know they're stressed out and they know they're not happy, but they don't know how to bring their happy back. They don't know how to tap back into that and to be able to start releasing some of the stress.
You're right, in a constructive way.
Exactly. Yeah. Without, I call them the isms.
Gambling,
alcoholism,
alcohol,
drug.
Right, exactly, exactly. Violence, domestic violence.
Yeah, and eating, the eating disorders and lack of exercise.
It does.
Yeah, it gets on them.
It does.
Yep.
So
I'm glad you brought that up.
Well,
yes. Men, it's very, very important. Your health is of utmost concern, and especially for Dr. Snipes. And it's so imperative that you take really good care of yourself. Nobody else can do it for you. Your wife can't do it for you. Your mother can't do it for you. Nobody else can do it for you. So please, if you can't call in to Dr. Snipes, make sure that you call in to your own doctor. Get a health checkup. That with a doctor who's concerned not only with your physical, but with your mental as well, with your emotional health.
And doesn't rush you through.
Yeah, and doesn't rush you through. So
that's when you can ask about these things.
Exactly. And that's another thing that I really do appreciate about the Medicare Part B is that it's not based on how many patients you see every single day. I'm not that I'm bad-mouthing HMOs or whatever, but they also are on a very specific timeline. So, many times you don't get the opportunity of being able to open up to your doctor. I
agree with you. So we try not to push at all people
So tell us how that has impacted then the healthcare of our society.
Well, I think it's made it worse, to be honest with you. I think all the pressures of the insurance company and Medicare and so on, and the paperwork that follows, has made healthcare worse, because that becomes more of a physician looking at the computer and not the person. It adds to paperwork, which adds to stress and such. So I think it, unfortunately, I'm sorry, it's deteriorated. And you don't find Marcus Welby out there anymore. I was the TV show back in whatever in the day.
I know.
Yeah, somebody told me about it. But it makes a huge difference. And that's where also, if you have a relationship with somebody, you'll tend to talk to them more.
Yes. And you know something, that's one of the things that I really do appreciate about you, because you have, going over and above in being able to provide your specialty, your expertise, to all various ages and some of the really critical issues, such as drug and alcoholism. How have you seen that rise?
Tremendous.
Really?
Tremendous rise. It's tremendous. In all, opiates, stimulants, alcohol, and so on and so forth. This is getting younger and younger. And I'll tell you, the opiates, in fact, we were talking about this the other day, the opiates, for example, heroin, are getting stronger and stronger and stronger.
That's what I was going to ask you, because I did hear that there is an epidemic.
There is, and a lot of people are dying because fentanyl, which is a much stronger opiate, is laced quite often with heroin. And then there's even one that's much more strong called W18, and it's tremendously strong. It came from China, and it's sometimes laced with heroin.
My goodness!
I mean, tens of thousands of times stronger than morphine. So that's what causes a lot of overdoses and deaths.
And you see that on the rise, then I would imagine.
When I was in high school, it was the worst thing people did was maybe get drunk a little bit one night and maybe smoke cigarettes. They were rebels if they did that.
Yes.
So it's a lot more dangerous.
Wow,
it really is. And so.
Yeah. So tell me, what are hospitalists?
A hospitalist, for patients to know about this. Years ago, physicians would basically take care of the patients in the office, and then they would go to the hospital if they were in the hospital and so on. That kind of proceeded basically around the 90s and such. And so hospitalists are inpatient physicians. They take care of patients, and I did that in Arizona for many years. But they take care of patients only in the hospital.
Oh, okay. Well, thank you for that. I really appreciate it. Doctor, it has been a pleasure to have you on our show.
Thank you.
You have brought some very, very specific knowledge, and I appreciate your insights, and
good. Thank
and
you.
especially what you're dealing with the insurance companies as well, because sometimes patients think that they're the only ones that are going through this kind of.
No, we're wanting to shave our head. Yeah, it's horrible. Yeah, it's a nightmare. But I can see their stresses too. I can see the insurance companies' needs too and their stresses. But the whole system is broken. Basically.
Yeah. Well, we're hoping that
it gets better.
Yes. So thank you very much for being with us. I appreciate that.
Thank you.
And I'd like to thank All County Healthcare as well for providing you and your doctor shows and allowing us to help you make those informed choices, the educated choices that are so important for your health care. We want the best for you. We want you to be able to live your fullest life and to be happy again. So we really do appreciate you coming and being part of our show this evening. You can find us every Tuesday night from 6 to 7 on 1470 AM, on wwnnradio.com, a live stream, on allcountyhealthcare.com, a live stream as well, and on All County Healthcare Facebook, live Facebook as well. So thank you again for being part of this. Have a great evening.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of the station, its staff, management, or sponsors.